So I was like born with pulmonary atresia. So my whole life I was in and out of the hospital, doing surgery after surgery.
Christopher was born with a condition where he effectively only had one pumping chamber of his heart. And he underwent a series of surgeries, first as an infant and then as a child, to allow him to live with essentially one ventricle, the pumping chamber that pumps blood to our lungs and our body.
In elementary, I was normal. It felt like I could do everything I wanted. And then middle school, I had oxygen. And then in high school, I just started to deteriorate more and more.
It was devastating because we had lost our daughter to the same heart condition in 1996. Christopher was born in 2000. I thought I was losing another one of my kids.
The Canaday family has had a lot of loss in their life. Their dad just passed away from cancer about 2 years ago. Right at the same time they found out that Christopher would need another heart.
Our electrophysiologist, Dr. Ovadia, referred us on to Dr. Liebo's team, and then we knew we'd have Dr. McGee, outstanding at what he does. So even though he was 17, they only do adult, we were a challenging case, so we got the amazing opportunity to come to Loyola and be loved as one of their own.
I was in the hospital for 212 days, and the things that kept me going was the nurses and family stuck with me the whole time. I was never alone.
Some days were overwhelming without the love of my life by my side, but to know we had guardian angels, my little girl and him watching over us. On those toughest days, the nurses would spend time and sit with me, and you can't find a team better than what we've experienced. We had a special way to tell him, and it was a giant heart because he has the biggest heart of anybody I know.
Everybody from staff, anywhere from housekeeping to food and nutrition, to our nurses, to our doctors, all signed the heart.
This is the first day the whole time he was born again.
He was in shock. He didn't go back to sleep for all that day.
Told him he had a great heart and everything had gone well, and I spoke with him going into it and said, this was the one we've been waiting for, and he came out doing great and the heart worked right off the bat.
I could feel the heart pumping. Everything felt right. Just, I could see better. Just colors were brighter. It was amazing.
And as a parent, to know the sacrifice another family is giving, which is a huge gift to be given, is so appreciated, as my husband was a donor as well.
It's hard to think about, but I'll definitely keep good care of it. Oh yeah.
To go home is exciting, but to leave our Loyola family is hard.
I think the staff at Loyola I couldn't be more proud of, because we all fought the fight with them throughout the whole time and waited on this journey for the new heart and was here for them at 3 in the morning, at 5 in the morning, at 12 at night, all the time. Night shift, day shift. I can really say that we treated the human spirit for the Canaday family.